Good afternoon everyone, and welcome to the presentation from the Bachelor of Radiation Therapy. Great that you can all join us. This is something new for us. We're trying this given with the level 2 restrictions we've got going. We can't do what we normally do with all of our cancer centre tours. So we're going to give this a bit of a go and see how it goes. First up, my name is Billy Moody. I'm the Director of the Bachelor of Radiation Therapy here in Wellington. And with me, I've got Georgia and Ellie. They are two third-year students who have nearly finished their training. They're in their final clinical placement here in Wellington. So it's great that they've been able to join me. And we're going to throw a few of the questions towards them because you guys want to hear from them and not from me. So how this is going to run, we've got a video to show you. We've done a video of a cancer centre tour. So I apologise if you have been on a tour. This will be a bit repetitive for you, but if you haven't, it will give you an idea of what an actual cancer centre is like, and what the workflow and what a radiation therapist does day to day. And then I've got a PowerPoint presentation which goes over some more aspects around the profession itself, but then also talks about the program and the requirements we have and what it's actually like being a student. And then at the end of that, we'll throw it open for questions.
Welcome to the Bowen Cancer Centre Radiation Therapy Department. I'm Logan, I'm the Clinical Lead Radiation Therapist at the Bowen Cancer Centre. So the first part of the radiation therapy process is coming in to have a planning CT scan. And in the CT scanner we have a wide range of immobilisation equipment which we use to position our patients in a reproducible position for their treatment each day. Our patients and feet are positioned in immobilisation equipment which we use to keep them still. So the first part of the process is making sure the patient is nice and straight, and we use lasers that come out of the ceiling and walls which you can see on the patient's body here, and we use those to straighten the patient, but also we use those for repositioning the patient each day as we have a similar set on the linear accelerator. We're always making sure that we have the correct patient on the bed, have all our strict identification procedures, a lot of patient reassurance, making sure that all of our equipment is correct and precise. The aim of radiation therapy is to have it as precise and exact as we can. So if we have a reproducible setup that we generate here when we capture our CT image, which is what we use to plan the patient's treatment, then that will translate exactly through to the treatment machine. It needs to be exact as we're delivering high doses of radiation each day, so the position that the patient is in needs to be reproducible on a daily basis so that we can hit that exact target every day. The next step in the process is the radiation treatment planning. So the doctor outlines on the CT scan where they would like to deliver the treatment, and the radiation therapist comes along, plans the radiation treatment to deliver the dose to the tumour, but minimise the dose delivered to the other surrounding normal tissue. The third step in the process is the radiation treatment delivery. Standardly, the radiation gets the patient from the waiting room and brings them through in the maze and into the radiation therapy bunker. The patient comes into the room onto the treatment couch, which is set up exactly the same way as they were for their CT scan. In the treatment bunker, we have an identical set of lasers to the CT scanner, which we use to align the patient first before proceeding with treatment. So to see the lasers, we dim our room lights down. So we raise the patient up on the couch, move the patient under the head of the machine, and we straighten the patient using the lasers like we did at the CT scan to reproduce that position. So at this point, the two radiation therapists would verify all of the machine parameters and all of the setup parameters for that particular patient and double check it against our setup sheets and all the information that we documented at the CT scan. And once we're happy with the setup position, we reassure the patient, inform the patient that we're leaving the room, and then we leave the room. So we have a last man out button on the wall, which is a sounding alarm, which alerts everyone in the treatment room to be out of the treatment room except the patient. We also have laser gates on the entrance to the bunker as well, and if the radiation beam is switched on and then someone accidentally walks into the treatment bunker, the beam will terminate straight away. At the treatment console, one staff member is always watching the patient on the closed circuit TV cameras. Both radiation therapists are verifying all the machine parameters against the treatment plan that was generated, and the treatment is delivered. So the treatment machine moves around the patient to deliver the treatment. So on the machine, as well as the treatment delivery head, we also have a kilovoltage X-ray unit which is mounted to the treatment machine gantry, so we can take X-ray images of the patient's internal anatomy to verify the correct location of our treatment before we deliver the treatment. Modern machines can also take a CT scan as well, which we can overlay with the CT scan that we took at the original planning simulation session to verify the internal anatomy that we're treating as well. Excellent, we'll see you back tomorrow at 10 a.m.
Yeah.
I chose a career in radiation therapy as I had a couple of grandparents when I was at high school that were having treatment, so I took them in for their treatments in my school holidays. And from there, the radiation therapist asked if I wanted to go into the treatment room and have a look and see what was going on, and I did. And it really fascinated me, the mix of patient care, technology, it's very precise. And then when I did a little bit more research into that, the applications with radiation treatment planning, physics, and the fast advancing technology is what really drew me in.
I really liked the mix of science but also medical, and the fact that you really get to make a connection with people on quite a deep level. You're seeing them every day for sometimes weeks and weeks at a time. And that's what really drew me to it, was that you could help somebody medically but also really form a bond with them.
I got into radiotherapy because it was introduced to me during my first year health sci. It ticked a lot of boxes in terms of my interests. There's quite a technical base to it, but it's also focused on improving people's lives and helping them when they're in a really stressful, challenging situation. It really appeals to me because I get to see these people on a daily basis and see them over a period of time where I get to see that we are making a difference, both clinically but also hopefully in terms of their mindset as they approach their cancer treatment as well.
I'm Billy Moody, I'm the Director of the Bachelor of Radiation Therapy at the University of Otago in Wellington. I got into radiation therapy, I was looking for a job working with people, and it's a cliche you'll hear a lot from the radiation therapy stuff, but it's truly why we're in this job. We want to work with science, but we love working with people. It's the rapport we build with our patients. Some of our patients can come for 7 weeks of treatment, and we'll see them 5 days a week over that whole 7 weeks. So we're not just treating the cancer, we get to know the person and we get to know about their lives, and we get to help them at this really critical time in their life. It does sound really scary. It's not. It's such a privilege to be involved in someone's life at that time of their life. Patients are very grateful for the care and the treatment we can give and the difference it makes to their life. I think the most common question we get asked about our job is when we say that we're radiation therapists, people will say, "Oh, so you take X-rays?" And at that point we go, no, we're the people who treat cancer with radiation. A very important part of our program and our training is that the students have large blocks of clinical on-the-job experience while they're training. So they work alongside with the RT teams here to learn how to be the best radiation therapist. The staff here and all around the country are very dedicated to our patients. They are dedicated to being the best radiation therapists they can be and delivering the highest quality of care. That extends to our students as well and training them to become radiation therapists. The job isn't about cancer. The job is about people. And when people come in here, we're not necessarily talking about their cancer every day. Many of our patients, we come in, we have a joke. Yes, there are questions we need to ask, and we're always making sure our patients are well for their treatment and that we're going to manage any issues that they might be having. But generally, we just really enjoy hanging out with people every day. So that was our wee video on the tour of the Bowen Cancer Centre here in Wellington. I'm now going to go over the PowerPoint presentation, which will also reiterate some of the stuff we've already talked about in the video, but we'll go over the program and some details about it. So as we've just said, what is radiation therapy? And our catchline is technology meets caring, and I really do think that encapsulates it really nicely. We are planning, it is about the planning and treatment of disease, and that disease is 99% of the time cancer. And we're part of that team who are treating those cancer patients, and the radiation therapy is part of their cancer treatment. As I sort of said in the, as I said in the video, we often get asked, people think we take x-rays, which we do incidentally as part of the treatment of the patient. But there is a difference. So diagnostic is a separate profession. We are sister professions. We came from the same profession. But the diagnostic is your x-rays, CT, MRI, ultrasound. So taking the pictures to do the diagnosis of what's wrong with something, we are the therapy, so just the treatment of the cancer centres and based in oncology departments. And we are part of a team. We are part of the team treating the patient within the oncology department. The radiation oncologists are the medical specialists. We work with the medical physicists, nurses, dietitians, social workers, speech therapists, psychologists. We are part of a big team working to deliver the best care for that patient. We covered off those 3 key areas, but there are the 3 key areas that we cover in working in a radiation therapist. So the CT simulation, and that's the first area a patient will come to. And that's where we are taking a CT scan, but we're taking it to use to just gather information about their body and the part of the body that we want to treat. We're not looking to diagnose. They already have the diagnosis at this point. At this point, we spend a lot of time making sure they're positioned correctly, because we need people, we're talking about millimetre accuracy on a day-to-day basis, and we want to make sure that we've got them positioned so that we can best determine their accuracy on a day-to-day basis. We do, you may have heard about, we do little tattoos at this point. They're just tiny little dots of ink under the skin. Basically, X marks the spot, essentially, and that's what helps us position our patients every day. Once we've taken that CT scan, we send all the information through to the specialist planning system. These are 3D CAD systems that we use to design what is the best way to deliver as much radiation as we can to the tumour, but trying to avoid all of the other tissues around it. And that's the big challenge in what we do as radiation therapists. A simple plan could take half an hour to create. A complex plan could be a couple of days worth of work. So it really depends on what we're aiming to do for the patient as to how long that part of the process will take. Once they get to the treatment, so once we've done all that, and it could be anything from a day to a week or 2 between that CT appointment and their treatment appointment, onto the linear accelerators, which are high energy X-ray machines. So it's very high energy X-rays that we're using for the radiation to destroy the cancer cells. And it's here where we see our patients on a daily basis. So it could range anywhere from 1 appointment through to 30 appointments, and we will see them every day. And it's at this point that we really get to know our patients really well. They're 10 to 15 minute appointment slots. Most of the time it's taken with getting them in the right position. The actual time to deliver the treatment is about 45 seconds to a minute. So lots of that time is spent with the patient, getting them in the right position. And here's every step of the way. That accuracy and attention to detail is really important for us. During the studies, you'll develop excellent communication skills and problem-solving skills. We work in teams all of the time when it's not an autonomous profession because we're wanting to safely deliver the radiation. We really don't do things on our own. You have really high technical skills. As you've seen, the equipment we're using is really high tech, and it changes quite rapidly. So we get quite excited about that because we really enjoy that technical side as well. We're looking for an empathetic nature with our patients, and as I've said, an eye for detail. I think also one of the most important things is adaptability. Your workplace and workplace environment can change really quickly. In 5 minutes, it can all be very different. So being able to adapt really quickly to what's happening within the department is also really important. You won't have those skills when you come on. This is what we develop over the course of the 3 years of the training. So what is it really like? One of the great things about radiation therapy, and certainly one of the reasons I chose it as a career, is it's more of a Monday to Friday working week. We tend to work mostly 8 till 5 kind of hours. There's a bit of on-call work, but it's not a huge burden on your life. So you get your weekends, you get your evenings, you know what your working day, when you're going to start and when you're going to stop. It is a really nice working environment, and Ellie and George will be able to talk about that a little bit more later on. And we always do work in a team, so that working with people doesn't just extend to our patients, but it's our team members as well. Most of our patients are outpatients, so that means they're living at home. Many of them are still working, going about their normal lives and coming into the department for their treatment each day. So most of our patients would seem very well normally. One of the great opportunities about this course is if you're thinking you'd like to go overseas, let's hope when we can get back overseas, there are great opportunities to work around the world, and I'll talk about that a little bit later on a bit further. The question we do get asked all the time, and it is a really good question, is it safe? And the answer is yes. Obviously, there's a lot of legislation and regulations. We don't get exposed to the radiation. The patient remains in the room, we leave the room to deliver the radiation. And that's an X-ray machine that when it's turned off, it's like pulling the plug at the wall. There is no radiation in the room when we go back. So that means you can continue to work if you're pregnant, you know, there's no issues about working around that radiation. And it's true, you are likely to receive more radiation from flying to the UK and back than you will in you working in a radiation therapy department. So it is quite safe. So how do you become a radiation therapist? So the program is a 3-year degree program. We're with the University of Otago, but many of you will have realised we're a little bit different in that we're based on the Wellington campus. So it's the School of Medicine through the University of Otago. So that's the academic side of things are based in Wellington, and then your clinical placements are around the country. And I'll talk a little bit more about that as well. One of the great things about radiation therapy is you are registered upon qualification. So that means you are fully qualified and you can start working immediately. And we are the only provider in the country. So if you want to become a radiation therapist, the only place you can do it is here at the University of Otago in Wellington. So we have admissions categories. So we take students coming straight from school. So that's the school leaver category. Equally, if you decide, maybe you want to think about it a little bit more, 1 year, if you do a year of study and then decide you want to come to RT, 2 years, graduate, and then if you've done something different in your life as well. So we kind of have a category that fits everyone depending on your situation. We are what's called competitive entry, and that's because we have a limited number of clinical placements. So we only take up to 30 students each year. The applications are open now, and in fact they close on the 15th of September, and that's an online application process through the University of Otago. There are some admissions subcategories as well, so we've got those main categories, but then subcategories that have some further criteria around them, but that you can apply through, and that's the Māori, Pacifica, rural, socioeconomic and refugee. And if you think you might fit into any of those subcategories, have a look on our website, or you can get in touch with admissions as well, who can talk you through that process too. So what is the selection criteria for school leavers? It is successful completion of NSA level 3 or equivalent. And what we're looking for is a minimum of 16 credits in each of these subjects. So in English or what we call an English rich subject, and those are the list that we have there. Plus you need to have a minimum 16 credits in a maths, we don't mind which maths, as long as it's at level 3, and then a minimum of 16 credits in physics or biology. You don't need to have both, it needs to be one or the other. So they are the entry criteria from coming from school. Now, obviously, when you're applying, you don't have your level 3 results at this point. But essentially, we're looking to see that, how did you go at level 2? So we do have a look at your level 2 results. And then we're looking to see, are you taking 16 credits in the right subjects? And then we interview based on that. If you come in through the school leaver category, if we make you an offer of a place on the program, it is subject to those NCA results. So you don't get finalised your place until the NCA results come out in January. So you'll get a provisional offer of a place. Here's where I was saying you can find, so basically our website has all of the information that you need. You can also contact Health Sciences Missions Office in Dunedin, who can also talk you through these categories and entry requirements as well. So if you do have questions about, is my qualification correct, I'd go first to the website. And then you can get in touch with Health Science Admissions or ourselves as well, and we've got some contact details but further on too. So if when you put in your application you look like you meet the requirements, those academic requirements, potentially meet them, the second step is you're then selected for interview. And once we look at that academic performance and your statement of interest, if that meets the criteria, we offer you an interview. Interviews are held in person, and we offer interviews in Dunedin, Wellington and Auckland, and you get a choice of where you would like to be interviewed. At the moment we're looking to hold those in person, and that information will come out with the offer for the interview. They're held in the last week of September, first 2 weeks of October, so those dates are also on the website as well. With that interview, what we're just looking to see is, can you establish a connection with someone quite quickly? Obviously, that's what we have to do day-to-day basis in the radiation therapy department, and that's what we're looking for at the interview. The interview is a gentle process. Would you agree? Do you recall your interviews?
Yeah, I found them, I was a bit nervous going into them at the start, as you would be, but it was really settling when you get in there and you just really have a good conversation. You ask a few questions, and it's just about answering and with confidence and having a yarn to each other, really.
Yeah, and all the people that interview you are really nice, so you feel like quite comfortable.
Yeah,
and then they are scary, obviously, in theory, but they're pretty good when you get there.
Yeah, we're not try not to be too scary.
Yeah.
So in good preparation for that interview, obviously a cancer centre tour is our usual recommendation, but in these times when we can't guarantee that, that's why we've provided that video for you, and that information will go up on the website as well, so you can look at that again. There are cancer centre tours still happening around the country, but it's a little bit, at the moment, some departments are and some departments are, just with the level 2 restrictions and requirements on that. Again, our web page has a lot of details and information on it. So the Wellington campus, we are a smaller campus, and it is radiation therapy students, physiotherapy students and med students based on here, with some dietitian students as well. The radiation therapy department kind of has their own little department area up the top of the hill at the campus. And these are some pictures from previous students, just looking at some of our classroom type. We have a system, now that linear accelerator you saw in the video, they cost $5 million. So strangely, we don't have one, but what we do have is a virtual system, which you can kind of see here, that aids in a lot of our learning in the first year, some of those concepts. The planning system that you saw being used on the video, we have that commercial planning system that we use, so you learn on the real products that are used clinically as well, and we have 40 licenses for those. The great news is you can do that planning from anywhere now as well. It's all cloud-based. This is some of the students in the sort of student common room, which is a study tea room / hangout room. I think people move in there during winter almost because it's nice and warm and you get to use the university's Wi-Fi. So that's a really great common space, and students get to share. Student life, it isn't all about study, and we really try and encourage that it's not all about study. Part of being a radiation therapist, and I think it's true for all of us, is we tend to give back through service to cancer providers of other support services available as well. And these are some of our students getting involved in all sorts of things. So you can see this is the Relay for Life. Our students are usually involved in Relay for Life. Doing some volunteering for the Child Cancer Foundation. These guys did a bake sale to raise money for the Cancer Society. So it's not all just study, there's a bit of trade, but there's also some fun as well. This is the last day. This particular class each year for their exams would dress up, and they came in something different every year. I think this was their 3rd year. They were all Where's Wally? And lots of gatherings and things together outside of work. So we do really encourage that balance of work versus play. One of the really nice things is that we are a smaller class. And how do you guys find having that smaller class environment?
I think it was really good because you become close with like most of the people that are like everyone in your class. You become kind of like a family sort of unit. So I thought it was really good to get to know people quite well.
Yeah, it's really nice just to get to know everyone in your class, and you might start off all sitting in the same seats, and then you start to get to know each other, and it doesn't really matter where you sit because everyone is willing to help each other, and you kind of all feed off each other. Once you're in the class, everyone's really helpful, and it was a really good environment to be in.
Classes can get quite tight as a group, and lots of our classes well beyond, lots of our year groups well beyond once they leave radiation therapy, the department here still really stay in contact and hang out together. And for many people, develop your lifelong best friends through the program. So it's a really nice, close-knit group. That doesn't just extend to the students. I think it extends to getting to know the staff as well. We're a small department. We're only 10 teaching staff. So you get to know us really well as well. I'm going to hope you're going to say that's a good thing.
No, it is a good thing.
It is a good thing.
It's also quite nice. You get to know the year groups above and below you as well. And because they're quite small, you do see their faces around all the time. So you get to know a good amount of people as well. Really nice.
Yeah. Oh. Right, so how is the course divided up, sort of the academic versus the clinical? So very much in your first year, it's mostly academic, based here in the Wellington campus. There is a 2-week cancer centre tour here. That's very much an introductory kind of visit, but most of the year is based in Wellington. Year 2 and 3 is a bit different. So in year 2, you spend the first 5 months of the year, nearly 6 months, out in a cancer centre. So this is where you are learning on the job, working alongside the radiation therapists to really, you've had all this theory here, now how do we put it into practice here? Once you've been out at that 6-month placement, it's back into the university for that 2nd semester of the year. First semester in year 3 is still at the university, and then it's back out for that final big 5-month placement that Ellie and Georgia are just nearing the end of now. And that's the final placement, and at the end here, when you've met all of the criteria of the placement, fully qualified, ready to go. These cancer departments, you'll be in a different department for each of those clinical components, and we'll get you to talk about those a bit more in a minute. So where are our cancer centres? We're the national provider, so our cancer centres are spread all around the country. So you could end up working in a department in Auckland, Tauranga, Hamilton, Palmerston North, Wellington, Christchurch, or Dunedin. when you come onto the program, we ask you, do you have a preference of where you'd like to go for those placements? We try our best, but we can't guarantee that you will get that placement. That just might mean you get to do a bit of travel and see a bit more of the country than you thought you might have otherwise. And I'll get you guys to talk a bit more about the clinical placements a bit later on, if that's all right.
Sounds good.
Yeah. Big question, accommodation. Where do you live when you get here in Wellington? Because we're a satellite centre of Dunedin, we don't have the halls or residences available that they do in Dunedin. A number of our students have now started using Victoria House, which is a Victoria University accommodation, which is a traditional residential hall, but you do apply to that through Victoria. And it might be that Victoria this coming year look to open up to other halls, as well as they may have fewer students with those international students not coming in. There are some other accommodation and more in that flatting style. There's the 222 Willis and the Southern Cross apartments. We have this information on our website as well on the accommodation page, or you can get in touch with the accommodation centre. So where did you guys live in your first year?
Well, both Georgia and I lived at 222 Willis, but I think it was quite good because it's a happy medium between leaving home and flatting, because you're in a safe environment where there's lots of people but you're in your own little flats, which is really good. But there's also other options as well, as we've got.
So Victoria House is more of the
traditional.
Yeah, the traditional halls, I guess you could say. So that's where you get your food kind of cooked for you, and you've got your single rooms and that kind of thing. But 222 could be an option if you're looking for something you want to cook for yourself. If you're very independent, that might be something you're more interested in. And yeah, other options as well as going towards that more hall version.
Yeah. And then some of our students do flat. They'll find flats around. Obviously, Wellington is a university city, so there are lots of student flats around. And other students may board or live with family or friends as well. So they're the main options that our students do use for accommodation during the course.
And often once you start the course, you'll find out, oh, this person's in my hall as well, and you kind of start to find some connections, and it's all a bit less scary.
Yeah. Thank you. All right, as we said, once you qualify, there's good employment opportunities in New Zealand and overseas. This is pretty good. It's salary starting at 60,000. Now this is from 2021. The starting salary will be $60,654, which is pretty good for a first year job. And you get automatic progression until 7 years post qualification. So you move up through, and I think that's going to be around 87,000 that goes to. Beyond that, progression is through getting more senior positions, leadership roles and things like that, but there is that automatic progression up the salary scale for 7 years after you qualify. Currently the government have a program which is called the New Graduate Program, and that offers placements in departments for 6 months available for new graduates. So that is not run by the university, it's a Ministry of Health program, but students are invited to apply for those within departments. So there's no guarantee of a job upon qualification, but many of our students, this new graduate program is the step into the profession, and from there many students may get a full-time job or maternity leave position and continue on in those departments then, and these guys are just in the process of applying for jobs now. Yes. So yeah, things to be looking at. Can you specialise? Yes, you can. You know, where can the career take you? So you can specialise in any of those kind of areas we talked about, the CT planning treatment, so you can become a specialist in that area. Clinical education an area as well, either within the department or within their university as well. And research and development is very much a growing area within radiation therapy. So developing radiation techniques and researching about them, either the techniques or patients' experience is the kind of research areas that are very much growing within radiation therapy as well. Yeah, we talked about working overseas, and a lot of RTs will go and work overseas. And where can you go? Well, the world's your oyster, to be honest, with radiation therapy. Many of our students go to Australia and the UK and Ireland are the well-worn travel paths, but we've got ex-students working in Switzerland, the Arab states, Scandinavia, Canada. We've had some work in Greece, we've had some work in Cyprus, so lots of countries around the world. And hand on heart, New Zealand's qualification is highly regarded overseas. That training across all three aspects of the program is unique to New Zealand and Australia. And so our graduates are really sought after in the departments overseas because of our high skill level, our high knowledge level, and our great work ethic. So if you want to travel, it is a great career to go traveling on. You guys thinking about that?
Yeah, definitely.
When COVID lets you.
Yeah.
Postgraduate doesn't have to end at the end of your graduate degree. You can continue on. So we have a postgraduate honours program, and then you can continue on to diploma, masters, and up to PhD level as well. Further information, as I said, go to the website. Visit our RT department website. There's lots of information on there that will answer a lot of your questions. And then, as I say, from there, the links are there to where to go to get more help for questions that you might have about your individual circumstance. We have a Facebook page, so follow us on Facebook. We put up all sorts of bits and pieces, mostly student-focused stuff, letting you know what's happening as well. So it'd be great if you follow us on there. And finally, we're going to leave the final word to some of the students about their experiences of being a radiation therapist.
Hands-on experience, being involved in the community, diversity, people from all walks of life,
interpersonal communication,
friendly classmates,
making a difference,
interactive learning environment,
whakawhanaungatanga, rewarding,
always more to learn,
variety,
interactive classes,
aroha, patient care and technology, personal interactions with lecturers,
clinical experience, hands-on learning, new challenges every day,
supportive groups,
close to home, lots of different people,
caring, science and technology,
a strong and fun team environment,
make a difference.
you get to meet heaps of cool different people.
All right, so that was our video and our presentation. So we'll just have a look. If you've got questions, now's a good time to pop them in the Q&A. So I'll just have a look at what we've got here. Could I get a recording? Yes, we will be putting up a recording. So that will go up onto, I think, our website, but we'll let you know how to get that. If you haven't done physics before, that's not a problem. So physics is part of the program, but we do provide a lot of support around that because we know a lot of people don't do physics at school. And our physics is very much tailored to radiation physics. So it's not just any kind of physics at all. And we put a lot of support around that. Would you agree?
I didn't do physics at high school, and I was a bit worried about that coming to the course, and it was not a problem at all. They really just start at the base level, and it's very specific to radiation, and we have really good lecturers. They'll actually take a lot of time and sit down with you and make sure you understand so you're not falling behind. Lots of good support.
Yeah. So don't be put off by physics as an aspect. Placements, are they paid at all? No, they are not. And your accommodation is not subsidised if outside of Wellington. Students who go to departments outside of Wellington, some will go to departments that are perhaps in their home, many of them will flat with friends, and I think it is part of the cost of the course that you do have to take into account, and that's why we do try and take into account your preference, if at all possible. Were you at home for your first placement?
I was in Dunedin, and so I was flatting with friends that I had there. So it's just kind of like paying, like you pay rent up here and rent down there. So
yeah,
it was all right.
Ellie, what about your first placement?
My first placement was in Palmy. I don't have a linear accelerator in Hawke's Bay where I'm from, so I had to go elsewhere than home, but it was really easy to find a good group of people to flat with through most unis, wherever the placements are, have like their, for example, they have the Massey University Students Association, so I just contacted them and they got me in contact with a flat, and it was easy to find.
Yeah, there's always people looking for people to like fill rooms, or someone's like left or something. So it's definitely manageable.
Yeah. What is the biggest challenge of the profession?
I find the biggest challenge for me is just making sure that and the link with my favourite part is patient interaction and getting to know patients and getting to really make connections with them too. But my biggest challenge is trying not to over connect, because then I become a bit too involved. But apart from that, I think it's really, really good to be able to get to make connections. That's my biggest challenge and best part.
And that's part of the learning of being a student, is we provide a lot of support around how to manage those boundaries with our patients. We do get to know them really well, but obviously we need to maintain those professional boundaries. So we do know it's the biggest challenge, but we do also provide that support for you, and that's very much part of the learning as being a student. Yeah.
I think the best part for me is probably getting that same sort of thing, the patient interaction, and having so much time on clinical placement. It's quite unique to this degree. We spend so much time out learning in the clinical environment, so you get to be hands-on working with people and also learning from the staff just as much as you learn from the lecturers. The most challenging part, I think, probably just moving around a little bit, but you really do learn a lot of adapting skills through the course, and I think I've grown a lot as an individual just from that alone, being able to move somewhere and meet new people and make the most of it. So there's definitely been perks of that as well.
Yeah, often what starts off as your challenge becomes your best part.
Yeah, exactly.
Yeah. And I think that's those most challenging things become the most rewarding things.
Yeah,
sometimes the way that goes. Yeah. How do students find placements in other centres if they are flatting in a fixed rental commitment? Yes, that is something you do need to consider if you're coming onto the course and you are fixed in a place and have to go somewhere else. That funding is unfortunately does fall to you to fund it, and then so for many students it's looking at study link and student loans and things like that. I do think that is why we do say though what the base salary is when you come out, compared to some of your friends who may be doing degrees. If they're looking at more generic jobs going out, the starting salary is quite high, so your ability to pay back the student loan is reasonable. Manageable, but it is something you have to consider.
We did manage to find a 6-month flat. It is definitely doable. Did you do that?
We've got one where there is a flat that's been passed through year groups. So that's June to June, so it works with your second year, third year crossover. But also at the same time, once you start getting through the year groups, you kind of find someone might be in a flat for one of the years and then they'll go in for 6 months and you'll take over if you're in Wellington still, or elsewhere. People might start their second year placement and then a third year might go and take their room in that other place in New Zealand. So with the connections that you do make with other year groups and your own year group, it kind of makes it easier to find flats as well. Yeah, so you really do collaborate a little bit on that.
So next question is, what is the workload like? That's a great question. I think I've heard it's 9 to 4 in the class, plus your reading and assignments on top of that. How many hours a week do you need to dedicate? So when we say it's 9 to 4, you're not in the classroom every day from 9 to 4, but lectures will only occur between 9 and 4. So we're not like some other universities. You won't have weekend lectures and you won't have evening lectures, things like that. But what you do have is building in more and more. So some days may be a full day of lectures, but then other days there might only be 1 or 2. So you've got that opportunity to do your reading and your assignments. How would you guys think about the workload and what?
I was a school leaver, so a lot of the information in first year to me was new. So I found that was a lot in the first year, but once you start to learn more and you kind of know how you learn best, I found it was definitely manageable. And we do have really good supports with the lecturers and even just the classmates. We all work well together and get everything done. Yeah. If you were struggling with something, there's definitely that opportunity to talk to lecturers and say, I need some extra help, or you won't be like left struggling to complete things. And yeah, everyone's really good about it.
You definitely do get used to like the workload as well. It's not unreasonably high. It's very like, you have to remember that the stuff that you have to do, like assignments and study and stuff, it's for your own knowledge. It's kind of like for being able to apply it. And I sort of found that like I would cope better with the workload when I was like, right, I'm learning this because it's going to help me when I'm talking to this patient about this, rather than I'm learning it to pass the paper. So I think it's a good work, like it's a manageable workload. I found by third year, I knew exactly how much I needed to do and was kind of doing exactly what I needed to do. First year took a while for me to get used to it coming out of school, but yeah, you get there, you really do.
Everything you learn is really relevant and applicable, and you learn that pretty straight away that everything that is getting taught is actually really important, and it's good to pay attention.
Yeah. Many of our students will have part-time jobs.
Yeah, definitely.
As well as the workload. It is important to note though that out on that clinical placement you are working a 40-hour week. So your clinical placements are a normal working day within that radiation therapy department, but you're on the job working. We don't have a lot of it is assessment on the job and it is learning on the job. So there's not a lot of assignments or any extra stuff that you need to do. The focus is really on the job. So you can still fit it between that sort of 8-hour working day.
It's quite nice on placement once you leave the department. Generally, you don't have to do anything outside of placement. Unless you need to want to do some more study or something, but yeah, it's very much within those hours.
You can keep up on your sleep as well, which
that helps.
Good. It does help.
Yeah.
Yeah.
How many people apply each year, and compared to the amount who get in? So we probably have, it does vary a little from year to year, but we'd have about 120 apply each year. We would probably interview somewhere between 70 to 90 each year, and we have a maximum size class of 30. So that gives you a bit of an idea if you get to interview somewhere about a 1 in 3 who will get into the program. I think next question sort of relates to that. Do we take a certain number from each application category? It depends on applications. We don't have a capping. We don't have fixed numbers from each category. We look across all of the applicants at the year and we take the best from the category. So no, there's not a fixed number from each application category. Variety within the day-to-day work. I think the variety is in the different types of people you're going to see, the different types of cancer we treat. You never quite know what's coming through the door day to day. And growth within the profession, yes. So there's growth within those specialist professions. And are there other pathways available from the job as well? Yes. So we're a good health sciences degree. So having said that, a lot of our graduates, stay in radiation therapy and they might go overseas. we've also got a lot of graduates working in the Ministry of Health, a lot of graduates going into industry, so those companies that make the equipment, they all have specialist RTs who work with there. So that's a growing area that people can go into sort of other allied health roles, into those middle management levels in hospitals and further on up. So there are other avenues you can go through with the profession, but certainly, yeah, the variety, yeah, I don't think that's a worry. Yeah. Yeah, those palliative treatment patients, so how are you taught or supported to deal with those patients who do pull at the heartstrings? Yep, you will get those patients. So I'll talk about the academic support that is around that. So across those 3 years, there are behavioural science papers that will very much teach you how to, about people and how to work with people and how to put those appropriate boundaries in place. And then that's very much supported in the clinical as well. So as students, we don't just throw you out there with any patient. We do manage the patients and extend you as you go further through your clinical experiences. Would you agree with that, guys?
I definitely agree. You get more used to it, and a lot of the time there's a big overarching, everyone's like, oh, cancer, you know, palliative treatment. But the thing is, they're a person, so when you meet them, a lot of the time you kind of don't even think, wow, this person's unwell, or wow, they're coming in for treatment. You just get to know the person and you kind of get to be connected to them rather than the fact that they're coming in to get treated, if that makes sense. I definitely find that if I ever am upset or find something a little bit hard to process, the staff are all really willing to help you out. Whether you're on placement, the clinical tutors are great, the other staff are great as well, or even at the department. So like all of the staff are really approachable and you really do get to know them as well. So they'll all help you through that sort of stuff. You're not alone and your friends are always there to chat to as well.
Yeah, definitely your classmates are really good to talk to, because you do see a lot of patients every day and you're dealing with different scenarios every day and you never know what's going to come through the door, like you said. So if something was overwhelming at that moment or just that day, you can always take a step out, and it's not going to be a problem if you have to stay out for that patient, if there's something that's just a bit triggering for you, or you know, you're just not up to it that day. It's completely fine, and you do learn a lot through these behavioural communications papers. They do go through each year and they're really important, more than you might think in first year. You're learning about listening and things, and you might not think it's that relevant, but as soon as you go out on placement and you're dealing with people every day who really need that really important communication skills, it's really relevant. It's really good.
Yeah, I think it's a great example of the challenge becomes the best part, though, because those patients remain really special to you. And as I sort of said, it's such a privilege to be part of someone's life at that point. And that's, you know, that's for me. So I'm in a different place to these guys in my career. I'm 30 years into my career. To me, that's the stuff that really still keeps me in it, is those connections you make with those patients and the privilege it is to be involved in their life at that time as well. So yeah, good question. Thank you. So Brett had a question, where do you see the industry heading to in the next 5 to 10 years? Yeah, good question. And a sort of another side question on it, we've had people ask, well, aren't we curing cancer? You know, isn't cancer going to go away? Well, there's research on cancer. Not in the next 5 to 10 years. Cancer is a broad number of diseases, to be honest. 5 to 10 years, the technology advances are incredible within the profession. So the more the technology, as it becomes more sophisticated, it allows us to give more radiation to the tumour and try and avoid all those normal tissues as much as we can. So that technology is never static and it keeps going. I think there's some exciting things coming around AI and things into radiation therapy. The thing that isn't ever going to change for radiation therapy is the patient at the end and the connection that we as radiation therapists are going to have to ensuring they get that best treatment. So that is the one thing that doesn't change in spite of all the technology, but there is some really exciting technology stuff coming every day almost. Yeah, that's another really good question. Would you say you've still had the university experience despite being in such a small course?
I think everyone has a different idea of what a uni experience is. I do. I feel like I've really made some really lifelong friends in the course. I've also, for me, the thing why I came up here is I really wanted to do this course. So often I think, you know, I've had a great uni experience because I've loved the course that I've been in. We do so much stuff outside of the course as well as a group, and you meet other people in Wellington and your halls that you know, you're going to be friends with forever, and you do all that kind of stuff. So I definitely think I've had a uni experience.
I definitely agree, and a lot of people could say like, oh, but don't you think it would be nice to be in one place for 3 years and be in halls and then flat with these people? But actually the 3 potentially different places you could be, you just get 3 new university experiences. Like, you just get to know more people. So I think you do still get a good university experience as well.
Definitely, what you just make the most of the situation that you get, and yeah, it's a lot of fun.
A number of our students do choose to do health science first year or a 1 year of a degree as well, and then come into radiation therapy, which can sometimes be a little bit the best of both worlds. If you want that big uni experience, you know, you go to a uni. Otago is obviously the one we're going to plug. So health science first year in Otago, but and then come into radiation therapy from there. So that's another way you can go about it as well, which a number of our students do.
Yeah, a lot of my good friends from not just my own year, but from the year below and the year below that have all been to uni before this, and I don't think either option is better or worse than the other. I think they're all great options, and it's just whatever's best for you, really. Yeah.
Look, I'm aware it's 6 o'clock, but and obviously if you have to go, then it's fine. I think these are great questions, and we'll just continue on and hopefully get through most of these. I think we've sort of covered this one in other degrees. People work part-time to fund themselves. Yes, it is possible with RT, particularly due to the academic component. People still do it during the clinical. It just makes quite long weeks for you as well, but obviously if that's what's required for your financial situation, people can do it and do it. Yeah, I'd say the majority of our students are working part-time. You take roughly 30 students a year. Out of that group, roughly how many graduate? To be honest, most of them graduate. You guys were about to, I don't think you were quite at 30.
We were 28.
28, and it's a graduating class of 23. And the reasons for that, so many people may find that the profession's not for them, not many, 1 or 2 a year. Some may have to repeat a year, some may have to put up because of illness and things like that. So it's a pretty high, and so even though it might be only 23 each year, some of those people might just be, for some reasons, taking a year out and then coming back in, so many still graduate at the end. We're wanting radiation therapists for the profession, so once you get on the course, we want to keep you. So we make it hard to get off. And do you have stats on how many gain employment after that? To be honest, the majority of our students gain employment within radiation therapy within 6 months of qualifying. I can't think of the stats directly off the top of my head. And that might be through the new grad program or into a permanent role or maternity leave role or something like that. I think what is important is if there are only limited jobs in each centre, so if you're very fixed on only working in a particular department in a particular city, then you might have to wait a little bit longer for that opportunity to come up. But if you're flexible and are prepared to perhaps consider more options for working, then yes, the majority of our students gain employment within that 6 months. Yeah, is it easy to, I think we've covered off that one. Is a job or as radiation therapist? Yeah, so the majority will get work as radiation therapists, as I said, within that 6 months. So apart from academic ability, merit and that ability to build rapport across, what do you look for in determining who gets a place on the program? I mean, those are the main factors. So we do take into account your interview, and we do look at your academic merit and how well you've done academically, and they are the two main factors that we're looking at across that process. Yep. If you don't pass the paper, do you have to redo a whole year? Yes, that is unfortunate because the papers are only offered per semester. But it's a very small number who fail a paper in a year. We put, as the guys have talked about, we put lots of supports in place, and it might just be one student. Some years we don't have any students repeating. Other years we might have one student having to redo a paper. So yeah, that is the thing with a professional program like this. Yeah. How are the assessments structured? Exams as well. Yep. So yes is the answer to all of those. So are there exams as well as assignments, and are they practical assessments? So yes, we have assignments throughout the year. So some papers are only internally assessed. Some have an internal assessment component as well as a summative exam at the end. When you are out on your clinical placement, it is all practical assessment. Would you sort of say there's a variety of assessment ways that we use?
Yeah, I think it's really good because no assessment is the same really. Like you'll have a practical one or just a general assignment or exams, and I think it just really keeps things more motivating to study for as well, like prep for, because everything's different.
Yeah, a couple essays, tests, presentations. We did quite a few presentations.
Group ones as well.
Yeah, definitely group work. Yeah, it's pretty good. But if you're struggling with an assignment, then definitely you can just talk to the lecturers or through them.
We put a lot of work into making sure that the assessment is purposeful and that it matches the style of the paper. So we don't assess for the sake of assessment. We don't assess anything that's not core knowledge. We're not interested in trick questions, anything like that. And as Ali sort of talked to before, the assessments are very much tailored to what you're going to be doing. It is really about the meaty subject of what you're covering. So you know, that's very much how we approach our assessments here as well. Do you learn much about cancer oncology during the program?
Yes.
Yeah.
Yeah. Yes, you do.
Yeah. So across all aspects of cancer, so the anatomy, the physiology, the cellular biology of the cancer, how the radiation affects the cancer, how the cancer affects the patient, side effects, how the radiation affects the patient and the cancer and side effects, and also how cancer affects people with that psychosocial part. So all of the aspects of cancer and oncology, yes, very much across all 3 years.
Yeah, quite a big aspect.
Yep. And it's fascinating, and we're all really interested in it. Yeah. What date will we know if we have an interview? Really shortly after when the applications close. Applications close September 15th. You will usually hear within the week because the interviews are quite close after that. I think we've covered this one, the factors in terms of your academic and that interview process as well. So they're the main things we're looking at for that. Part-time opportunities in employment. We are predominantly female profession. So many women are off having babies and then coming back part-time. So yes, there are part-time opportunities available. Very much depends on the department and what's available at that time, but yes, many of the workforce are part-time. Yep. Yes, we are still looking at the same academic requirements this year, despite the coronavirus changes. Yes, they're a regulation for us. So still looking at those 16 credits per paper. Are the gradings the typical ABC, or is it a different one like MED? Across our papers, it is the usual grading GPA system that the university use. The only difference is in our clinical papers, they are competency based. So you're either competent or you're not, so it's a pass or a fail. Otherwise, all of the other papers are graded as in the typical way. Yep. So as I said, you can travel as much as you want. I certainly travelled for 3.5 years overseas. How long do you have to remain in New Zealand before moving overseas after being fully qualified? It's up to you. You can go straight away. I think most radiation therapists would recommend, and you guys are about to find this out, that it would be good to stay a year after you qualified. You think your learning curve is steep as a student. I can tell you the most steepest learning curve is that first year qualified. As a student, there's always someone holding your hand. When you're qualified, there isn't, and that first year is really important for embedding all that knowledge and things. But having said that, you are fully registered, you can go, and we have had students, we do have a number of students who go straight to Australia upon qualification. So you can do, or any time after that point. Yeah. Yep, so that is in the PowerPoint. In the first year, it is in Wellington on the campus. Almost all year is the academic focus on campus, apart from the single 2-week placement that we do early on in the year. Your placements then start for the second year. They start the first week of January in your second year. Yep, so straight into it after Christmas, basically. Difference between all the different careers that are involved in the treatment machine. So all of the areas that we've covered, you will rotate, you roster through all of those areas as a radiation therapist. As you become more experienced, you can then choose to specialise in an area. Basically, we split it into pre-treatment and treatment. So there's the CT and planning, which is the workup for the treatment, and then there's the treatment itself. So I hope that answers that question for you. Yeah, attributes and characteristics make a good RT. Go.
You got to be personable, I reckon. Able to build like rapport with patients, but also like really good at teamwork as well, because you're just constantly collaborating with other RTs and other different professions, like the doctors and physicists and everything.
Yeah. Could be really good empathy, really caring, good listening skills is good, adaptable, and yeah, I think the teamwork is really important. Have a good eye for detail.
Want to continue learning as well. Yeah. As I said, the technology is always changing, so we're always learning and we're always adapting our practice. So being really interested in science and technology, technical aspects of things as well, and being prepared to continue your learning. The learning doesn't stop when you qualify, it goes all the way through your career, which again is another of those challenges and the best part too. Yeah. Where is your campus in Wellington? We are on the Wellington Hospital site. So the University of Otago has a building on the site of the hospital, so we're connected, joined on to the hospital, and that's where we're based in Wellington. That's where all the lectures take place. Nothing in particular I can recommend experience-wise coming into RT, other than drawing on the experiences that you've had in teams or other workplaces you've worked on, and so thinking about, have you been in a sports team where you've had to work collaboratively with other people? Have you had a part-time job? Have you been involved in leadership roles in school and all those things? All of those things are giving you those attributes that we're looking for in RTs. So can you reapply if your first application is not successful, and will the university genuinely consider? Hand on heart, yes. So if you're not successful the first time, we really welcome reapplications from staff, and we've got a number of students on the program who didn't get in the first time, who reapplied again, and even we've had 1 or 2 who've applied 3 times and gotten in on the 3rd time. So it is genuinely not a barrier. If you don't get in the first time, we really encourage you to reapply again. Yep. Yeah, so do you get many people making a career change to radiation therapy after being in the workforce for a while doing something else? Yes, we do. So the majority of our class are school leavers or 1 year university, and then we have the next group were probably those who have got a degree already and then have gone, well, what am I going to do with this, and are wanting to do something more practically based. And then we do have others who have gone, the career I'm in isn't for me, I want to change. And there'd be a couple of those in every year. So again, age is not a barrier to coming onto the program as well. Yeah. If my academic results were the best in school, is there any good chance I still get chosen for RT? We obviously have a minimum criteria, and we are looking for that academic ability. So I think it's always best if you're not certain, you can always put an application in. There's nothing to stop you applying, and then we're able to assess your suitability at that point. The other thing is if you want to discuss those kind of things individually further, you're welcome to get in touch with us through the RT Inquiries email address, which you'll find on our website as well if you've got those individual kind of questions. How many students do you get in the alternative category? We get a number every year, and we do take a number every year. I mean, I'd say in each class there would probably be a maximum of 4 from the alternative category, and it is probably our smaller category that we have, but no, we certainly do get students apply, I think a couple of a year. Yeah. People that have a degree, yes, unfortunately you do need to complete the full 3 years, because we are very specific to radiation therapy. All of our papers are specifically aimed at radiation therapy. So even though we're talking about behavioural science, it's all around cancer. Talking about anatomy, we're looking at imaging as well, and cancer and things like that. So there's very few papers that can be cross-accredited, and so it is a full another 3 years. Yes. With the qualifications, are you looking for 16 credits across those 3 subjects on top of the NCA level 3 completion? No, so that's your, so if all you've got is 16 credits in biology, that's fine. We're not looking for extra on top of, are you talking about the credits you require for it? So that can be the number of credits you got for that paper that goes towards your level 3 qualification. That's what we're looking at, not extra on top. I hope I answered that question correctly for you. Yeah, another good question. If unable to get in first time around, what would you suggest studying before reapplying? Obviously, health science first year is a good option, but any science subjects, to be honest, and when we're talking about science, we are very much looking more at the biology. Again, I've talked to you, don't have to go down the physics route, because we do put a lot of support in that. But physics, stats or maths papers, psychology papers, but keeping it in that science kind of area. So health sciences certainly does that. Many universities will offer a health science degree or a general science degree is fine. And even if it's only you do 1 year of it and then come in and apply, that's fine as well. We have reached the end of our questions. That's a great round of questions, guys, and I think we've covered lots of information. I thank you for your time. I'm going to leave it with Georgia and Ellie to finally, so I probably hammered the point that a lot of information can be found on our website, so that's a great place to go if you've got further questions. You can get in touch with us through the RT Inquiries email there if you've got specific questions around your individual circumstance. But I'm actually going to put Georgia and Ellie on the spot again. Why did you choose radiation therapy?
Similar to the video, I had family who've had experiences with cancer and radiation therapy as well. I really wanted to do something medical, and being involved with patients and helping people was the biggest draw for me. And it was that combination, like we've been saying, without the technology and the patient interaction was what I really loved. Being able to build the rapport with people over potentially multiple weeks is something really special, and being part of the care for them at that time is really nice. So yeah.
Thank you, Ellie.
Well, mine was a couple things, but when I was little, I was in hospital for a little bit, and I sort of saw a lot of people getting treated really well by staff and stuff like that. And it sort of sparked a little, I want to go into med and I want to help people. But I didn't really know what area of med I wanted to go into. And then I kind of wanted to become an oncologist, but I got told a lot about how you'd actually see a lot more patients and you get to know a lot more patients and on a more personal level in radiation therapy. And one of my friends was also doing radiation therapy and she got me into it, and I have not regretted it once. I really enjoy it. So it was a good choice, definitely.